Do you know the vital signs of a diabetic foot? Welcome and thank you for joining us on this journey to uncover the mysteries of diabetic foot. Imagine a world where you walk around without the slightest idea that your foot is silently suffering from a condition that could potentially lead to serious complications. That's the reality for a significant number of people with diabetes. They are blissfully unaware of the ticking time bomb that is diabetic foot, a condition characterized by damaged nerves and poor blood circulation in the foot. Diabetes is a widespread condition, affecting hundreds of millions of people around the globe. Among these, a significant portion experiences complications with their feet due to nerve damage and poor blood flow. This could lead to a range of problems, from minor skin changes to serious infections that could require amputation if not treated promptly. So, why is understanding diabetic foot so important? The answer is simple. Early detection and prompt treatment can prevent a minor issue from becoming a major problem. By recognizing the early signs of diabetic foot, individuals can seek medical assistance before the condition worsens, thereby preventing serious complications. Diabetic foot complications aren't a rare occurrence. They're a serious concern affecting a substantial number of individuals with diabetes. It's a problem that can lead to life-altering consequences, making it crucial for diabetics and their loved ones to be well-informed about the condition. But how can one be well-informed without knowing the vital signs to look out for? That's what we're here for. Over the course of this video, we'll explore the key signs of diabetic foot, from changes in skin color and foot temperature to foot pain, discomfort, swelling, and non-healing sores. Each of these signs plays a critical role in the early detection of diabetic foot complications. Recognizing them can make all the difference in preventing severe outcomes. Knowing the vital signs can help prevent serious complications. So what are these vital signs? Keep listening. The first vital sign to watch out for is changes in the color of your foot's skin. Now let's take a moment to delve into why this is so important. Our skin is like a window into our body's health. It can show us signs of what's happening on the inside. For instance, have you ever noticed how your skin turns red when you're cold? That's because your blood vessels are trying to keep the heat in. Similarly, changes in the color of your foot's skin can indicate an underlying issue. These changes don't necessarily mean something is wrong, but they can serve as a warning sign that needs your attention. Imagine you're painting a picture. You start with a blank canvas, your healthy skin. Now, if you start to see redness appearing on your canvas, that could be a sign of inflammation or an infection. It might be your body's way of saying, hey, there's something going on here. Next, you notice some bruising, like dark smudges on your masterpiece. Bruises are often the result of an injury, but if you can't remember bumping or hurting your foot, these unexplained bruises could be a sign of poor circulation or a blood clot. Lastly, let's say you spot a purplish discoloration, like someone spilled some grape juice on your canvas. This could be a sign of venous insufficiency, a condition where your veins have difficulty sending blood from your legs back to your heart. This can lead to pooling of blood in your legs and feet, causing that purplish hue. Now keep in mind, these color changes might not always mean there's a problem, but they are certainly not to be ignored. They're like your body's alarm system, alerting you that something might be off. So if you notice any changes in the color of your foot's skin, whether it's redness, bruising, or a purplish discoloration, it's important to reach out to a healthcare provider. They can help you understand what's happening and guide you on what steps to take next. Remember, any noticeable change in skin color warrants a visit to your healthcare provider. Another vital sign to be aware of is a change in your foot's temperature. Why is this matter important, you may wonder? Well, let me explain. You see, your feet are like barometers for your body's health. A sudden change in temperature, either too warm or too cold, can be an early warning sign of a serious medical condition. An unusually warm foot, for instance, can indicate a potential infection or inflammation. Inside your body, your immune system is like a tiny army, always ready to battle foreign invaders. When an infection is present, your immune system kicks into high gear, increasing blood flow to the affected area and raising its temperature. This is your body's way of trying to kill off the harmful bacteria. On the flip side, a foot that feels unusually cold can indicate a circulation problem. Your blood is like a highway, carrying oxygen and nutrients to every cell in your body. If this highway gets blocked or narrowed, it can result in a reduced blood flow to your foot, making it feel cold. Now, let's talk about how to monitor foot temperature. This isn't a guessing game, folks. It's more of a science. you can use an infrared thermometer which gives a quick, accurate reading of your skin's surface temperature. Ideally, you should check your foot temperature at the same time each day as body temperature naturally fluctuates throughout the day. Remember to compare the temperatures of both feet. A difference of more than 4 degrees Fahrenheit between the 2 feet can be a sign of trouble. It's essential to stay vigilant and take note of these changes. It's not just about the comfort of your feet, but about your overall health. So let's stay in tune with our bodies, folks. If your foot feels consistently warmer or cooler than usual, don't ignore it. Consult with your healthcare provider. After all, it's always better to be safe than sorry. Pain or discomfort in your foot is another vital sign to watch out for. Now let's delve into this a bit more. Foot pain or discomfort can be a sign of several underlying issues, particularly in individuals living with diabetes. You see, sometimes this discomfort could be an indication of nerve damage, also known as neuropathy. When the nerves in your feet are damaged, you may feel a variety of sensations, including tingling, burning, or even sharp stabbing pain. You might also experience a loss of sensation where your feet might feel numb or like they're walking on cotton. On the other hand, the pain could be a sign of poor circulation. Poor blood flow can lead to cramping, particularly in your calves during walking or exercising. These cramps usually go away when you rest, but return when you're active again. Let's not forget about infection. Infections can cause a throbbing pain, redness, and swelling. If left untreated, these infections can lead to serious complications. Therefore, it's essential to keep an eye out for any signs of infection. Another type of discomfort you might experience is a feeling of tightness or stiffness in your foot, especially in the morning. This can be due to muscle or tendon issues or even joint problems like arthritis. So you see, foot pain or discomfort is not just a simple annoyance. It can be a sign of something more serious, something that needs your attention. The type of pain or discomfort you're experiencing can give you clues about what might be going wrong. It's essential to understand these signals, to be aware of them, and to take them seriously. Remember, it's not just about dealing with the pain, it's about understanding what your body is trying to tell you and taking the necessary steps to address the issue. Pain or discomfort should never be ignored. If you're experiencing any, it's crucial to consult with your healthcare provider promptly. Pain or discomfort should never be ignored. Always consult with your healthcare provider if you're experiencing any. The fourth vital sign of a diabetic foot is swelling. Yes, you heard it right. Swelling, or edema as it is medically known, is a common condition that can be particularly concerning for individuals managing diabetes. So why does this happen? In simple terms, swelling occurs when excess fluid gets trapped in your body's tissues. This can be due to several reasons. In the context of diabetes, high blood sugar levels can cause the body to pull fluid from tissues, leading to swelling. Additionally, some diabetes-related complications such as kidney disease or heart disease can also contribute to swelling. Now, let's talk about why swelling can be a red flag. While mild swelling might just be uncomfortable, severe or persistent swelling can be a sign of a serious problem. It can indicate poor circulation, a common issue among diabetics, which can lead to various foot complications. It could also be a sign of a diabetic foot infection, which requires immediate medical attention. Monitoring for swelling is a crucial part of managing diabetic foot health. But how do you do it? Well, it's simpler than you might think. Regularly check your feet and ankles for any signs of puffiness. You could also use the press test. Simply press a finger into the area of your foot that's swollen. If the skin doesn't bounce back immediately, you might be dealing with edema. Remember, everyone's body is unique, and what's normal for one person might not be for another, so it's essential to know what's usual for you. If you notice any changes, like your feet are more swollen than usual or the swelling doesn't decrease after a period of rest, it's time to ring the alarm bells. A crucial point to note is that while monitoring at home is important, it's not a substitute for professional medical advice. Swelling, especially if it's sudden or severe, should be evaluated by a healthcare provider. So don't hesitate to seek help if you're dealing with persistent foot swelling. Your feet carry you through life, so let's give them the care they deserve. The fifth and final vital sign of a diabetic foot is non-healing sores. This is an issue that can often be overlooked, but it's crucial for those with diabetes to be aware of it. You see, individuals with diabetes are more prone to developing foot sores that don't heal properly. This happens due to high blood sugar levels that can damage nerves and lead to poor blood circulation, particularly in the feet. With reduced sensation, a small cut or blister might go unnoticed and can evolve into a non-healing sore. Now, why is this a problem? Well, non-healing sores or ulcers can lead to serious complications if left untreated. They can get infected, which can spread to the bone and cause bone infection. In severe cases, this might even lead to amputation, so it's not something to be taken lightly. Monitoring for non-healing sores involves regular inspection of your feet. Look for any cuts, blisters, redness, swelling, or nail problems. It's a good idea to use a mirror to check the bottoms of your feet or ask someone else to help if you have trouble seeing. Also, remember to check in between your toes. If you find a sore, don't panic. Clean it with warm water and mild soap. Apply an antibiotic ointment and cover it with a bandage. Avoid putting pressure on the sore by wearing comfortable, well-fitted shoes, and keep your blood sugar levels in check to help the healing process. However, if a sore isn't showing signs of improvement after a week or so, it's time to ring the alarm bells. That's when you need to seek medical attention. A healthcare provider can assess the situation and suggest the best course of treatment, which might involve antibiotics, wound care, or in some cases, surgery. So remember, early detection and prompt treatment are key to preventing complications from non-healing sores. If you notice a sore that isn't healing, it's time to see a healthcare provider. Stay vigilant and keep those feet healthy. Now that we've covered the 5 vital signs of diabetic foot, let's summarize. Firstly, we delved into the changes in skin color. It's crucial to remember that any unusual coloration on your foot, be it redness, blueness, or a darker tone, could be a warning sign. It might indicate a circulation problem or an infection, both of which require immediate medical attention. So don't dismiss any color changes as mere bruising or staining. Next, we discussed changes in foot temperature. A foot that's significantly colder or warmer than usual might be signaling an issue. A warm foot could mean inflammation or infection, while a cold foot might point to poor circulation. Regularly comparing the temperature of both feet can help in spotting any abnormality early on. The third vital sign we explored was foot pain or discomfort. Persistent or recurrent pain, tingling sensations, or numbness in your foot is not something to ignore. These might be early signs of diabetic neuropathy, a nerve damage condition common in people with diabetes. Don't let the discomfort become a part of your daily routine. Reach out to your healthcare provider as soon as you notice these symptoms. Our fourth topic was foot swelling. Swelling or edema could be due to various reasons, including kidney issues, heart disease, or a foot infection. It's essential to keep a close eye on any swelling, especially if it's accompanied by other symptoms such as pain or skin color changes. Lastly, we talked about non-healing sores. A small, seemingly insignificant wound or blister that doesn't heal could escalate into a severe problem if not addressed promptly. Non-healing sores are often the first step towards a diabetic foot ulcer, a serious condition that can lead to amputation if not treated in time. In conclusion, monitoring these 5 vital signs, changes in skin color, changes in foot temperature, foot pain or discomfort, foot swelling, and non-healing sores, is a crucial part of managing diabetic foot. These signs serve as your early warning system, alerting you to potential problems before they become severe. But remember, while vigilance is essential, it's not a substitute for professional medical care. Regular checkups with your healthcare provider are just as important as self-monitoring. They can help detect any issues early on and tailor a treatment plan that's best suited for you. So if you notice any of these signs, don't delay seeking medical help. It's not about being overly cautious, it's about taking charge of your health. After all, when it comes to managing diabetic foot, prevention is always better than cure. Remember, early detection is key in preventing diabetic foot complications. Stay vigilant and don't hesitate to seek medical help if needed.